Hello everyone, this is Bob Brown with Community Coronavirus Update number 99. Today we'll talk about the fact that our hospitals are full again, Omicron. I think there's reasons for concern but not panic yet, and that really understanding that beating pandemics is a game of percentages, kind of like Tom Osborne used to say that football is a game of inches. And so you really got to understand the percentages. The big headlines, though, of course, is the hospitals are overwhelmed again. We could have seen this happening, unfortunately, but what we're seeing the headlines in the Omaha World Herald, Journal Star, that we're in the middle of a COVID hotspot. The young unvaccinated are filling up Nebraskans. Nebraskans are filling up the hospitals and the ICUs. And I think a key thing to understand. I think there's a nice quote from Dr. Matt Donahue, our state epidemiologist, that younger people are less likely to become severely ill in general, but unvaccinated 30-year-olds are just as high as risk as a vaccinated 80-year-old. So that vaccine cuts down the risk of an 80-year-old down to that of a 30-year-old, but still that's high risk, and that's what people keep missing. So we'll talk a little bit about that later in the update. State numbers keep going up. We're in the highest numbers we've been since December. It's not even across Nebraska, but Two Rivers, for those who don't know, Two Rivers Health Department covers Lexington, Kearney, Holdridge area. There are no ICU beds left. They have 0 beds open. Omaha is also here seeing a big surge, so they were kind of leveled out for a while, but then they've had a big uptick in the last week or so to the high thing. The other thing to keep in mind is, although we had a big surge with a higher peak last year, it was up fast, it was down fast. This is prolonged and now headed back up, and so this is creating more of a strain on the hospitals. Plus, they had some warning and prep here where they actually delayed procedures and created some capacity issues. Weren't able to do that this time because we're still filling in the backlog. Lincoln's not doing too bad. So the blue line is actually Lincoln residents in the Lincoln hospitals. The orange are the people being shipped in from surrounding areas. So we've kept our numbers low, but Lincoln area has the highest vaccination rate, and we still have a mask ordinance in place. So that's keeping rates down, whereas the rest of the state doesn't have that, and that's why the numbers are going up so fast in the rest of the state. It's frustrating to me because we should have seen this coming. Basically, when you're looking at this, the hospitalizations are a lagging indicator. Case rates and positivity rates are the leading indicators, and so we should have seen this coming for weeks, and many of us did actually. It'd be nice if the state would finally start looking at this. That's why we need an ongoing state dashboard that doesn't get taken up and taken down. It needs to stay there so we can prep and be ready for this and prepare our hospitals next time. Kearney area, this is Buffalo County. You can see really high case rates, really high positivity rates. We knew this was coming weeks ago. Unfortunately, not much was done to stop it. So now the headlines, unfortunately, nationally about this Omicron variant, I don't think there is reason to be concerned. That's why it's a variant of concern, but it's not a variant of panic. And I think people are overreacting to this. It could be an issue, but it might not be an issue. So I'd say stay tuned on Omicron. But really, our problem right now is still Delta. So we aren't past the Delta crisis. So why panic about Omicron when we're still struggling with Delta? Beating pandemics is a game of percentage, and so let's talk about some percentages. So again, like Dr. Donahue said, a vaccinated 80-year-old has the same risk as an unvaccinated 30-year-old. So we can reduce the risk of people dramatically by vaccinating, but we can't reduce it to 0. And so people seem to have this binary, it's either all or none thing. We have to have layers of percentages to reduce risk to save lives and prevent overwhelming our hospitals. This is a problem that's really frustrating. So someone I know texted me two mornings ago. His dad's in the ICU. He actually did everything right. He did get his 3 shots, but he's still in the ICU. Well, that's because unfortunately the risks aren't 0. Even though you're vaccinated as an 80-year-old, you still have some high risk. That's why everybody around you needs to also be vaccinated. And so this is a group decision, and it's not just an individual decision. If we want to save the 80-year-olds, even some of those are still going to get sick, even though they're vaccinated. What we do need to do is vaccinate the 30-year-olds and the kids. That's our big problem. One way to look at this, Brian's been putting out these hospital puts these visualizations and shows pretty obviously that obviously unvaccinated are more likely to be the hospital than unvaccinated, especially when it comes to ICUs and ventilators. But actually, this even understates it all because you have to remember this little pool of vaccinated hospitalized is coming from this really big population. So if you look at Lincoln, the age distribution of who's vaccinated and not, that small group is coming from this large group. So the huge group of folks that are unvaccinated in the hospital is coming from this really small population. That tells you that, if anything, that visual understates it. That this, if the vaccine didn't work, this would be flipped, but it's actually the other way around. And a lot of these people, 50 to 64-year-old, 40 to 49-year-olds, they're coming from this little tiny population here. And so these are the people we need to start getting vaccinated. Until we get those folks vaccinated, we're going to keep having these capacity issues. And of course, the people who might be infecting grandma and grandpa are the grandkids. So we really need to start getting the kids vaccinated over the next coming weeks if we want to save holidays. Otherwise, we could be dealing with this Delta surge and over capacity hospitals for a month or more, and our hospitals, I don't think, can take that. So, steps to end a pandemic, we talked about this multiple times, but again, back to percentages. Vaccinations, we need to be 85% plus, and it needs to be the whole population, not just pockets of the population. Someday, well, I don't know, if you don't like mask mandates, okay, but we're going to have to figure out something else then if we're not going to do a mask mandate. That's when you're going to have to do other things to slow spread, non-pharmaceutical interventions like masking, distancing, ventilation, filtration, and testing so we can know and prepare next time and do a better job. We need to do all these things if we want to get it right. At the end of the day, your numbers are either going up or they're going down. So the effective transmission needs to be less than one, and we're not there yet. And it's going to take multiple layers. Right now, Delta is still the problem. Omicron might be a problem, but there's still a lot of data yet that needs to come in before we start worrying about Omicron. And there could be some good signs, actually, just depending on which way things go. So, three key questions on Omicron, whether it's really a problem. Number one, is it more infectious? And it might be. There's some early indications it may be more infectious, but not necessarily, we don't know for sure yet. Does it evade immunity? This is a bigger problem because if your infection or vaccine induced immunity is not stopping it, that means we may be starting over again to some extent. Although it won't be a 100% or 0% thing. Even if it does evade immunity, you'll still have some immunity from past infection or vaccine. The big question, though, is it more severe than Delta? Our hope is that it won't be. So is it more infectious? And again, Dr. Caitlin Jetelina is probably still my go-to source on staying up to date on this stuff. She posts almost daily about Omicron, about whether it's an issue or not. And so the waves of COVID in South Africa, where it came from, though it's giving people concern, is the prior variants in South Africa with their prior surge. These are these waves, and they're fairly steep, but look how steep Omicron is. Now, this isn't Omicron versus Delta, because Delta wasn't a big deal in South Africa, so we don't have good comparative data for Omicron versus Delta yet. We'll have to wait and see what happens in the other countries that it's already spread to, and it's pretty much worldwide by now. That's, again, one of the things she focuses on and others is that travel bans really don't work, because by the time you start seeing it, a lot of times it's already spread, as we've already discovered. It was in the United States a week ago. We just didn't know it yet. What we'll need to find is the countries that it's spread to. Is it spreading faster than Delta or not? And that's going to take a few weeks for us to know that. And so what we'll look is for transmission. So in Ecuador, for example, there was some concern about the Mu variant, but Delta so outcompeted it. So even though this one was a little bit more likely to evade immunity, Delta was so much more infectious that it actually pressed it down to almost zero. In the United States, Delta is pretty much the only game in town right now. So we'll see if Omicron comes in and starts overtaking Delta. That's how we'll know that it's actually more infectious. But that's going to take a few weeks to see what happens. The other thing I could say that one of the things we need to do is to have a better organized, more systematic, more common sense approach to travel. People shouldn't be allowed, I don't think, to travel internationally unless they're vaccinated and tested repeatedly. Hopefully we'll develop some international standards here so that we don't have this keep happening. Because right now it's kind of a hodgepodge if you've traveled internationally. So the key questions, does it evade immunity or is it more severe than Delta? We'll have to wait on the immunity side to see, okay, who's getting infected. And so we'll find out over the coming weeks on this one. Is it more severe than Delta? Well, it might be, and if it's not, but it might not be actually. And so some of the early cases so far aren't showing that the Omicron is leading a lot of hospitalizations. Unfortunately, though, that takes a few weeks. So from infection to hospitalization often takes two weeks or so. So again, that's a lagging thing. So we're not going to know for weeks yet whether it's more severe or less severe. But regardless of this, the strategy is mostly the same for both Delta and Omicron. And so regardless of which variant is the problem, the responses are still the same. We need multiple layers, and that's the biggest problem. I think people keep wanting this one-pronged approach. We're never going to control pandemics with a one-pronged approach. We need to do combinations again: vaccinations, ventilation, masking, good test, trace, and isolate. All those together are what we need if we want to stop a pandemic. So combinations of things, vaccinations with boosters. It looks like Pfizer and Moderna, and getting a booster after Johnson & Johnson, you're seeing 90 to 95% efficacy after that booster. Hopefully, it'll last longer with the third shot as in relation to the second shot. We'll find that out over time. Masks vary quite a bit, and so what we need to talk a little bit about is improved masking. If you're in high-risk places, there are variations. Disposable surgical cloth mask may only be about 50 to 60% protection, but a better mask, which we'll talk about in a minute, could be better. Distancing, we don't know. One of the concerns of both Delta and Omicron is maybe their aerosol spread, in which case distance actually doesn't work much like it used to for the prior variants. And then ventilation and filtration will become a much more important thing in the future potentially if this is the case. Booster shots again. So thankfully the CDC made it simpler now and just said everybody over 18 get your shot. So there's none of the stratification, risk, age. Just basically, if you're over 18, get a booster. Under 18, we don't know yet, and the under 18 might not need a booster. 2 shots might be enough for them. This is not unique. We have other vaccines where there's different schedules for different age groups. But we're going to have to talk a little bit about masks though too. So masks, there's good masks, which such as like a good well-fit cloth mask or a surgical mask. There's better masks, kind of like a KN95 or the KF94 Korean mask that I kind of like to wear. And then there's the N95 that's actually fitted for you, is probably the best protection. So you can kind of move up this spectrum here. For if I'm just going to the quick shop, yeah, I'm okay with one of these masks. But if I'm going to be in a high-risk setting, like when I was at the state education conference, I was mostly wearing a KF94 because nobody was wearing a mask at the Omaha conference, and I know folks from outstate weren't vaccinated. So if I'm in a high-risk place like that, or if I'm on an airplane, I'm going to want something like this. Maybe here I don't get a fitted N95. My wife wears one at the clinic, but for most of us, I think we should be moving up into these range of masks if we want to stop the contagion, including in schools. If you want a good article about the science behind some of this, there's a good scientific article, American article I've linked in the notes sections, why we need to upgrade our masks and where to get them. The good news is the supply is pretty good right now. You can get them on, at the pharmacy or Amazon or something like that. And of course, testing. These are now easily available. I've done these a couple times. After I took a rapid after that state education conference when people come for Thanksgiving. I wanted to make sure I wasn't the conduit to my mom and dad or my father-in-law. There's an exposure that I may have had, so a few days later, even though I'm vaccinated, I don't have to isolate, but I still tested 6 days later just to make sure I was negative this week before coming into the office. We need to use these for added layers of protection for everybody. Other things that are sort of annoying to me is there's still a lot of weird cocktails being prescribed by some urgent cares and doctors out there. So the Zithromax, prednisone, things like that should not be used in the outpatient setting for coronavirus. The only thing that is really showing to protect early on in coronavirus is the monoclonal antibodies for high-risk people. Now, if you're admitted to the hospital, the steroid dethymexamine might help, but that's only when people are in oxygen in the hospital. You should not be using prednisone in the outpatient setting. That actually has been shown to increase your chances of having health problems. So hopefully we'll get some better treatment out there. There's some other good discussion. If you want this audio interview with Eric Rubin and Lindsay Baden talked about what's gone right so far. It's not all bad news. We've learned a lot. They also talk a little bit about the controversy of vaccine-induced immunity versus, quote, natural immunity from having an infection. It's kind of really hard to sort out for sure which one is better, which one is more effective than the other. In the end, though, I think it doesn't matter. There's waning of immunity. You don't want to get repeated infections anyway, so vaccination is still the right solution. So immunity from infection versus vaccination, both wane over time. Like I said, will repeated doses of either be permanent? That's kind of really the big question, actually. So if you got coronavirus twice the hard way, maybe that's going to be enough to make you permanently immune, but maybe not. Well, maybe 3 boosters will be enough, but maybe not. That is not an unusual thing. Basically, we found that influenza and coronavirus may be infections where you're just going to need boosters over time. So just like we covered before, a lot of vaccinations are 2 and 3 shot series, but some are 4, 5, and 6, and some are annual. So Tdap, tetanus, diphtheria, brucella, you're going to get those throughout your whole life, basically. Same with influenza, you actually may get it yearly, and the same thing may be true for coronavirus, and that's okay. So I've heard people say, for example, well, I'm just going to have to get a booster, so why worry? Well, you're going to get hungry again. That doesn't mean you quit eating just because it didn't work permanently, and so sometimes, things have to be done over and over again, just like you have to go to work every day. So, and then the last thing, of course, just like flu shots, the best way to protect grandma is to get her grandkids vaccinated. So if we're going to get together with everybody for Christmas, please get the kids vaccinated. I think this is no longer, the studies are good enough right now. We've had millions of kids vaccinated. They're doing fine. Please get your grandkids vaccinated. Hopefully this, again, like usual, hopefully this is helpful to you. Here's what I do for a living. And disclaimer, these are my opinions expressed in these YouTube videos, not necessarily the above organizations, but this is where I work, so you know what I do.